This lecture is about management, scheduling, time management, staffing, and productivity. The objective for this lecture covers is to identify the mechanisms, systems, and techniques needed to properly maintain, organize, and prioritize workloads and intervention settings, including inventories. Budgets is managed by administration with input from the staff, particularly for capital equipment needs. OT is a revenue generating service, meaning it brings in revenue, and the only expense would be for um, the time for paying the employees. The goal is to provide quality care that is cost effective, and charges for services needed to be appropriate and agree with documentation. Also regarding the capital equipment needs, that's just equipment needed for the department itself. Productivity. Productivity is something you will hear about every step of the way in your job, in your new job, and this is important to ask questions about during an interview. Basically, how much productivity am I required to have while I am working here? This is important. If the employer says that you need to be 150% productive, run for the hills. If they're talking 80 to 90%, that is reasonable. What is productivity? Productivity is a ratio between the output and the resources expended to obtain the desired output. It is direct versus indirect patient care. So your direct patient care is you're actually in the room treating the patient. Your indirect patient care activities are paperwork, screening a patient, talking with nurses, staff. Those are all considered indirect. Important to obtain productivity data to determine the cost effectiveness of the program and for program planning purposes. Some models of service are communication and intensive for coordination purposes. For example, Alzheimer's Day Treatment Program, and thus have more non-productive time. Productive time, again, direct services that generate revenue, is patient treatment time. It used to be patient conferences. I'm not sure if all companies allow for billing for patient conferences these days. And then every 15-minute period is considered a module or a unit. The unit is what's typically used in therapy. Again, non-productive time, staff meetings, in-services, documentation time, unless it's done in the patient's room while the patient is doing some activity. Scheduling, student supervision is considered non-productive time. This is an example of daily schedule for two different therapists, John and Sally Joe. The schedule blocks out 1 hour or 4 units and half hour or 2 unit slots for various patients they are seeing, plus additional activities that can be considered non-productive or non-billable time. An example of non-billable time would be PW time or paperwork time, or screening a new patient to see if they are appropriate for the program. These patients are officially seeing occupational therapy, but a nurse may have seen something the patient is doing that will need the services of occupational therapy. For example, a patient's upper extremity is getting tighter and the patient may benefit from a splint. The OT would go in, do a hands-off, this is strictly hands-off, assessment of the patient. If the OT thinks the patient will benefit from OT services, then they will get an order from the MD so they can officially make or order a splint and do a more efficient eval for the patient. So now I'd like you to take a moment and pause this lecture. Go back to slide 6 and figure out how many units each of the patients received throughout this day. Remember, 15 minutes equals 1 unit. Then total up the units and divide by 32 to get their productivity for the day. So for example, Roscoe was seen from 7:30 to 8:30, and then again from 12:30 to 1:30 on John's schedule. How many units would that be? So take a moment now and come back when you're ready. Did you get the following answers? For John, Roscoe had 8, Mayer had 6, Brooks had 6, Black had 6, and the total units were 26. Productivity, 81%, and for an OTR, 81% is not bad. Here's the answers for Sally Joe's. Green had 6, Hernandez had 6, Johnson 4, Smith 4, Davis 4. Total units 24. Her productivity was 75%. That may be considered lower, but she did have more non-productive time. Preparation, maintenance, and safety. Safety is the key in any department. It is crucial to have a clean, safe environment. The facility must abide by codes for accreditation and licensing. Adequate space and equipment and resources needs to be present. Staff education on safety issues will be done, and typically this is done on a yearly basis. The facility standards and means of measuring if they are met. Also, reduce control environmental hazards and risks. It's very easy to, if there's a cord in the way, put it out of the way. If there's water on the floor, wipe it up. It is everybody's responsibility for safety, not just for the employees, but for the patients. You want to prevent accidents and injuries at all cost. Some things are just not preventable, but whenever possible, think before you do. OT practitioners' responsibility to bring attention to any situation that compromises safety for patients, staff, and the public. Incident reports and risk management committees are part of each facility. They review any incident reports and then make recommendations of maybe if they're seeing a trend, what they could change in the process. Incident report is completed by the OT practitioner and reviewed and signed by the supervisor. Supposed to be completed for anything from a paper cut to and more severe, but follow the facility's policies. Each facility will have their own incident form. Information does not go into the client's chart. Again, does not go into the client's chart. Nor is it mentioned in the chart. The form is used by risk management to coordinate try that again. The form is used by the risk management coordinator and committee to determine if corrective action needs to be placed. When I say talk about it should not be in the patient's chart, I'm talking about the incident report form should not be in the patient's chart, nor you should not write that you wrote up an incident report form, because then it becomes a legal document. You can talk about, the patient had to be lowered to the floor and what you did about it, but just the facts, but do not state that you actually wrote this on a form. On the form, answer the questions directly and concisely and do not embellish. Keep it descriptive and avoid evaluation of the incidents. Some safety control considerations. Infection control procedures must follow the facility's policy and procedures for infection control. The most important procedure is hand washing technique so to reduce the spread of infection. The next, universal precautions. Universal precautions are precautions for patients who are in isolation. This can mean wearing gloves, a gown, and a mask. When you see a cart outside the patient's door, ask the staff what the patient is in isolation for. It could be MRSA in a wound, or it could be TB. Storage of toxic and chemical flammables. All toxic chemical and flammables must be labeled and placed in the correct storage areas. For example, toxic chemicals can be cleaning supplies. All chemicals must be listed and have a material data sheet in the binder of what to do if a spill or ingestion happens with that chemical. The knowledge of emergency and fire procedures. It is everyone's responsibility to know and to be able to follow the emergency procedures. Drills are run yearly to keep up on your skills. Back care. Following back precautions is crucial for you to sustain a career in the medical field. Don't take chances with your back. Falls. Falls will happen. Someday in your career you may need to lower someone to the floor. The key is to follow up on the correct procedure to getting the patient up and filling out the proper paperwork afterwards. If you hide this, it is more detrimental than the fall itself. Handling of sharp objects. Put sharp objects in a safe and proper place after use. Food storage. Store food properly. In occupational therapy, you may have a kitchen to work on meal preparation. Make sure the food is labeled with expiration date. Also, don't ever place food items with medications. Managing supplies and inventory. Often this is the job of the CODA. Your job is to keep track of what supplies are available and let whoever order what supplies are needed. You want to keep a minimal amount of inventory to keep costs down. Having too much inventory is just as bad as having not enough. It is like a store having too much inventory on its shelf. It costs money to the department. Some time management tips. Prioritizing your responsibilities and engagements is very important. Some people do not know how to prioritize and become procrastinators. I admit I have been a procrastinator from time to time. A to-do list places items in order of importance. One method is the ABC list. This list is divided into 3 sections, A, B, or C. The items placed in A section are those needed to be done that day. They're high priority. The items placed in the B section need completion within a week, and the C section items are those things that need to be done within a month. As the B and C items become more pertinent, they are bumped up to the A or B list. Try it or come up with your own method, but do it. Keep resources handy. Carry your planner and your binder clipboard in which you gather useful information and resources. We talk about a 3-ring binder. We talked about keeping yourself organized, putting your papers in your binder right away so that you're not constantly looking through the binder. Take notes, write down useful information in your planner, and then be prepared. Carry supplies you need during the day in a tote bag and restock as needed. Trying to be perfect person sets you up for defeat. Nobody, and I mean nobody, can be perfect. Difficult tasks usually result in avoidance and procrastination. You need to set achievable goals, but they should also be challenging. There will always be people both weaker and stronger than you. For an example, an acquaintance of yours would like you to see a movie with him tonight. You made social plans for tomorrow with your friends, and tonight you are going to study and do laundry. You really are not interested. You want to say no, but you hate turning people down. Politely saying no should become a habit. Saying no frees up time for the things that are most important. Keep things in their place, avoid wasting time and energy looking for lost items, and then set your watch about 5 minutes ahead. This helps encourage promptness. Another suggestion is to combine several activities into one time spot. While commuting to school, listen to taped notes. This allows up to an hour or 2 of day of good study review. While showering, make a mental list of the things you need to get done. When you watch a sitcom, laugh as you pay your bills. These are just suggestions of what you can do to combine your time, but there are many others. Above all, be creative and let it work for you. So in summary, you have learned about how to facilitate organized schedule for patients' care, how to find ways to improve time management, and staffing and productivity standards. You do have an assignment related to this. It is located in the content section on D2L.